you hear the words, you're going to need surgery. And with those words from your doctor, everything changes. Most people do all they can to avoid this, but for some, surgery becomes the best path to dealing with pain, inconvenience, and restrictions caused by joint pain. This month, we introduce a new series from Duncaster called Health for All from Duncaster. In this series, we'll be talking about issues impacting your health and healthy living. Hello, I'm Andrea Obston, and we're introducing this new series with some tips about getting back in the game after joint surgery. I'm joined today by Lauri McCrorey, a physical therapist at Caleb Hitchcock at Duncaster, and John Wheat, who's actually been at Duncaster. We're going to talk a little bit about what you can do to prepare yourself for surgery if you have that opportunity, and the role that rehab plays in getting back on your feet. So Lauri, I've just gotten the words, I'm going to need joint surgery. What should I do?
Well, first off, hello, Andrea. Thank you for having me. And John, it's very nice to see you again.
Likewise.
First thing a person should do if they're a surgical candidate is to get themselves a prescription for a pre-op therapy program. Attending a preoperative therapy program, which includes aquatic therapy as well as land therapy.
Why would you want PT before the surgery?
Well, this type of activity prior to a surgery would allow a patient to go in and review actual exercises that they'll have to do. It would be great if they didn't feel the pain while first experiencing the exercise. Right. So they'd go over exercises specific to a joint replacement. For a hip replacement, there are certain motions that one must avoid after the surgery. So they'll have that one-on-one experience with their physical therapist or occupational therapist prior to that session and review the exercises. They'll also have the ability to discuss different pain management options with their physical therapist. There are different modalities that we could use in therapy. So that would be reviewed, and very fortunate to have that experience before coming in.
Would they do any actual exercises, or is this more conversation?
Yeah, no, we're actually going to take them through the paces. They'll go through the actual therapy exercises that they'll need to perform after their surgery. They'll actually ride the equipment. They'll do the exercise. We'll instruct in precautions that they'll need to go through, the whole 9 yards. It is preparation for the actual experience after surgery.
You also mentioned to me something about sort of pre-training someone on using assisted devices. Talk about that.
You know, some of our patients coming to us after a joint replacement have never used an assistive device. They've never walked with a walker or a cane. So that's a valuable time to learn the routine of using an assistive device, because there is a wrong and a right way to use a cane or a walker after a surgery.
Well, that makes sense. So before joint surgery, what should a person ask about the afterwards?
Questions to ask. I always say, it's your time to ask a question. You shouldn't hesitate to ask questions. You want to know all you can about a joint procedure before you have that experience. A good question right off the bat is there anything that I could do first off before having the surgery? Could you have certain medications? Could you have physical and occupational therapy? That sort of question will allow you to measure where you are. If you've exhausted all those opportunities to get better, you feel you need to have the surgery. You want to ask the question of, should I have pre-op therapy? Should I have post-op therapy? Should I have physical or occupational therapy afterwards? A question to the physician may be what to expect in regards to pain before, during, and after the procedure, just so they could have a clear understanding of what's going to happen after they have had the procedure.
Okay, so they've had the procedure, And for some people, they end up going into what's called a short-term rehab center. Talk a little bit about what happens at that point. The surgery's over.
Okay, they've had their pre-op, they've had their surgery. Short-term rehab is actually post-operative rehab.
Okay.
So that person would come to a facility such as Caleb Hitchcock and receive 7 days a week of physical therapy, occupational therapy. Some require speech and respiratory therapy. There's wound care specialists there. There are nursing staff there. So we would get that person based on the procedure that they've underwent. We do the specialized activities. We get their pain managed. We get them upward and mobile with a device, and all in preparation to get them home at their highest level.
How fast does that happen? I mean, how fast does someone, they've had, say, a knee or a hip, how would you say get them up? I mean, does that happen quickly?
Actually, getting up happens in the hospital.
Really?
So they should be familiar with being upward and mobile the day of surgery.
The day of the surgery?
The day of surgery.
Wow.
Today, we're seeing patients even earlier than previous years. We're seeing patients day number 2 from afterwards of their procedures. So they'll come to the facility, we'll get them upward with the physical therapy and occupational therapy experience on their way.
So John, you had an unexpected and unplanned visit.
Very unplanned.
So talk a little bit about that.
Well, I had a bad bike accident. January, went out riding the 150-degree day at the early part of the month, and managed to get into an accident where I broke my collarbone, my shoulder blade, 2 ribs, and one of the ribs nicked a lung.
Very thorough of you.
I thought, if you're going to do it right. And made it to the emergency room, got fixed up at Hartford Hospital, was in Hartford Hospital for several days. The real complication, I wasn't operated on per se, but I had to be slinged up, and then I had to have a chest tube because of the lung problem.
Because of the lung problem, okay.
So I was on a chest tube for 4 days, and then on the 4th day, they took it out, and I was, at that point, I was thinking, okay, I'm going to go home, but maybe that's not such a great idea. One is I was going to need respiratory therapy. I was going to need some degree of initial physical therapy to help with the mobility on the shoulder. And I also wanted to give my wife a break, who had been sort of living through this experience with me for 4 days. And I thought it would be smarter to go someplace where somebody could keep track of what was going on with me. I could start the initial therapies. And it was in the middle of January. I knew one of the things that they'd want me to do was walk around. Well, walking around my house would be kind of restrictive, and I certainly wasn't going to be going outside where it was icy.
Yeah.
And
asking for trouble.
Exactly. And so I was familiar with Duncaster. It's down the road, has a good reputation. A friend of mine actually went in for a rehab on a knee and had a great experience, and I thought that's a perfect solution. Asked the care coordinator at the hospital to help arrange that. They got in touch with Duncaster.
I didn't realize you could actually ask for a rehab center.
Apparently you can. I did. And they were aware of it and thought it would be a good idea. And so, we checked on insurance coverage and everything, and all that lined up. And so off I went on the 5th day and spent about 5 days at Caleb Hitchcock at Duncaster. And turned out to be a great experience. The food was good. I knew I was in the right place when I came in, and there were some longer-term residents there who needed that kind of care. And they were all sitting around at the cocktail hour having a glass of wine, and I said, well, this is clearly the right place for me. But seriously, the food was good. The people were terrific. Everybody wanted to make sure I was comfortable. I walked into the room and everything was sort of oriented for somebody who was right-handed. Well, it was my right side that was injured. And within seconds, everything was rearranged so that I could reach things with my left hand. I had access to physical therapy, some light movement around. I also needed help bathing. The chest tube was out. I had a very large dressing on my right side that I had to be careful about. And then when that came off, I still had to figure out that, and so I had help bathing. which, you know, you don't think about, but it's those little things, those daily things that you have to do that you need help with. And I also had the opportunity, could walk around the whole building, which was a whole complex. And, you know, I was able to get some distance because they wanted me to walk around, partly because of the lung. I needed it just for my own psychic well-being.
Yes.
And so I had the opportunity to actually take a fairly, you know, 10-minute walk around the building, which would be hard to do at home.
Yeah.
So, you know, basically all of that worked out really well for me. And it was a terrific experience. People were nice. You know, I had visitors and I had a TV set. So
what kind of
fine.
therapy, Lauri, you work with John? What kind of therapy?
You summed the experience up exactly as I remembered it. You know, he had a brace on, a G-force brace.
Oh, yes.
And then he had the tube. He did not require training with the device because you're high functioning. You really were able to become ambulatory once again, but you enjoyed more occupational therapy, more respiratory therapy.
Right.
My job as a physical therapist was by far the easiest. So the occupational therapist had to re-educate you on how to dress yourself,
right.
maintain that arm in a non-weight bearing position. So you went under occupational therapy for those educational tips and tools. To be instructed on using adaptive equipment to take the place of using that right arm. The respiratory therapist was in with breathing devices to have you practice.
Right.
And you're right, the building is sprawling. Usually after an injury where your legs, your balancing coordination are not the big issue, we want you to walk.
Right.
That's actually the best exercise for you. So we have 2 levels there, so just walk and enjoy and see what's going on. So it was an interesting case, short-lived. You were in the building a mere 6 days, I believe.
I think so,
5 or
yes.
6 days, so a nice case.
Yeah, and I guess a point, my injury was, you know, compared to many, not terribly extensive, but things like putting on a pair of socks.
Yeah.
How do you do that when you only have one hand?
Is that what occupational
That's
therapy
exactly what occupational therapy does. You couldn't move your shoulder. You had
No.
orders just for passive range of motion. So the occupational therapist was able to get in and take your extremity through the motion. You even had a restriction with that. You couldn't go beyond 90 degrees.
That's right.
The doctor cleared you to straighten and bend your elbow. You had motion in your wrist, but how do you don your socks? So OT definitely gave you tools, adaptive equipment that you could use to help out.
I think the thing is you never realize what you need, as much as you try and anticipate based on the discussion a minute ago.
Yeah.
It's those little things that you never think about. You know, if you shave with your right hand.
Yeah. You couldn't.
I couldn't.
Yeah.
Now, as it is, I'm mostly left-handed for that kind of thing. So I was pretty fortunate, if you can call it that. But I still needed help with all manner of stuff, you know, and as I said, dressing was quite a challenge. And, you know, you have to sort of learn how to do it all over again. You feel like you're about 5 years old.
Really?
But you know, the staff at Caleb Hitchcock was fantastic, you know, and very patient. And after a while, you know, when you're in the hospital, you get used to being woken up at 2 in the morning for, you know, vital signs, take a pill, what have you. And they were doing that at Duncaster because that was part of the protocol. But after a while, they realized he's fine. Let's not wake him up, at least for the last couple of days. It was great. Anyway, but you guys were terrific.
Thank you. You were a wonderful patient.
So talk a little about the variety of therapies that someone might say they had a hip replacement or a joint replacement. You talked about occupational. Talk a little bit about the kinds of therapies someone might expect after that kind of surgery.
Well, the traditional therapy, as you mentioned, the OT and PT, but we also are fortunate to have a respiratory therapist on board. We have a speech therapist on board. Not so often, but every now and again, something may go to the left in surgery, and they may have some depressed lung activity, or they've needed a tube and they're no longer able to ingest regular diet consistencies. Okay. Respiratory therapy, speech therapy is then called on board to assist with that. So not everyone just requires PT and OT. Respiratory therapy and speech therapy comes on board in cases where you don't always expect them.
So I'm very intrigued about that pool and how you use the pool for rehab. Talk a little bit about that.
Okay, and since we're on the topic of joint replacement, we would use aquatic therapy prior to the surgery, just to condition the muscles for the activity.
Okay.
Less weight bearing through the joints or stress through the joints. Wouldn't typically use it during the short-term rehab because the incision is still open, and then we'd follow up with an outpatient plan for aquatic therapy.
Why don't we talk a little bit about that? Because John, you did have outpatient.
That's
After you
correct.
got home, you weren't finished with therapy.
Oh, not by a long shot.
What happened there?
Well, at that point, the doctor who I'd been working with then had outpatient physical therapy prescribed, and so I was going to. I didn't go to Duncaster. I went to an outfit on Farmington Avenue, and they basically. I was trying to regain mobility in the joint.
Okay, so
the
that
shoulder
was sort of
freezes
the after.
up really quickly, and you have to sort of break through a lot of scarring and. Just atrophied tissue, and this took weeks.
Really?
Oh yeah. I mean, it takes a long time. Shoulder joint is very, very complex. I had basically breaks backwards and forwards. The ribs and lung problem kind of went away after a week or two, but the shoulder took a lot of work to come back.
So there's work, Lauri. There's work essentially before the surgery. Mm-hmm. Right afterwards, and then John's experience of literally weeks and weeks of physical therapy?
Absolutely. If you had the chance to prepare,
right,
that's ideal. But in John's case, that wasn't his scenario.
Right.
It speaks to the importance of short-term rehab and then following up with the program thereafter. Most people feel better 3 months after, but it takes 6 months, up to a year, to actually regain the function and the mobility and all the strength in your extremity after a planned surgery or an unplanned accident.
Okay, so when you do all these, what is the ultimate goal for you as a therapist with the patient?
The ultimate goal for me as a therapist, when I meet my patient, I sit down and I find out what their problems are, and in the back of my mind, I'm documenting what I'm going to try. Ultimately, after a joint replacement, we want to reduce the swelling, control the pain, and get them stronger, get them back to their prior level of function, ultimately. Get the flexibility there, get them on the road to buying into doing exercise, not just during the stay there, but indefinitely.
Do you send them home with exercises?
Absolutely. We plan to give handouts for specific exercises. They're all individualized, and we send them home with that information. We invite them to speak to their doctors to go forward with additional therapy.
So some people might come back to Caleb Hitchcock at Duncaster for that part of the
continuum of care. If someone leaves our facility, they require home care services because they're homebound. They're unable to drive or get along. We may recommend that they have a course of home care therapy with the expectation that they come back to finish their healing process, so to speak, and come back for outpatient therapy.
So I know this is an unfair question, but I'm going to ask it. Typically, hip replacement, how long can someone expect to not feel up to 100%?
Mark your calendar for about three months from the date of your surgery.
Really?
At that point, you're going to feel happy that you had the surgery, that arthritis pain is gone. but it takes upward to 6 months to a year, as I mentioned, just to make sure you work all the kinks out of there and
Really?
you feel fine. There are also restrictions that you have to adhere to. So you're learning how to move much differently after you have a joint replacement.
For how
So-
long are those applied?
And that's depending on the procedure itself, the orthopedic surgeon, him or herself. So a patient would go back to their doctor and have that conversation. Some doctors will say 6 to 8 weeks after. Some doctors say indefinitely.
Change the way you move that
Absolutely,
joint. That's
absolutely.
interesting. Excellent. So, John, your recovery, how was that?
Well, recovery came along pretty much as forecast. The thing of it is, the bone has to heal.
Right.
And so the bone takes anywhere from 8 to 12 weeks to heal. Because, I mean, it was a full break. And then you have the soft tissue stuff that you're working on. So you kind of have to take everything very slowly. I've had a previous shoulder operation for another reason, and I was signed up for the fact that this was going to be a long haul. And, but, you know, you take it day by day by day by day. And if you don't overdo it, which is a danger.
In other words, I feel okay. I might as well
I
just
feel
go back to
okay,
it.
so I'm going to,
Yeah.
you know, lift a little more weight, be a little more aggressive in the movement. You can set yourself back. So, you know, I paid very close attention to my physical therapist when he said, you know, do this, but not that much. And literally looked at it as each day I'm going to get a little bit better, but it's only going to be a little
But
bit.
don't jump
but
ahead.
Don't jump ahead.
Okay.
Don't jump ahead, and just keep going. At this point, I have 100% mobility. Strength is back, and you know, I'm fully functioning on sort of all cylinders at this point.
Wonderful. Well, I want to thank you, John, for sharing your experience, and Lauri. These are really, really valuable tips, and I appreciate you taking the time. And remember, it's a good idea to consult your physician before surgery to find out what options there are for a rehab center. And then take the time to really research those options. Take a tour, meet their staff, check their rating from the Centers for Medicare and Medicaid Services. They use what's called a star rating system, with 5 being the highest. Make sure one of the things you look at when you're deciding on a facility is that rating. We hope you've enjoyed this first segment of Health for All from Duncaster. If you have any questions about the topics we've covered today, please get in touch with Duncaster's Vice President of Health Services, Lisa Holloway. And join us next month when we'll talk about some of the therapies that go beyond physical rehab, like pet therapy, music therapy, and art therapy. And thanks for joining us. We look forward to seeing you again next month at Health for All from Duncaster.
Funding for Simsbury Community Television is provided in part by contributions from viewers like you. Thank you.